Kennedy Smith's 3-year-old son Theo is down with a case of the flu, and she's worried about her options.
I'm feeling kind of overwhelmed and scared because the last thing I want to do is end up in CHEO.
She's trying to avoid this place, the Children's Hospital of Eastern Ontario. A hospital built to serve 120 children a day is seeing more than that every hour. Since September, nearly 1,000 flu cases have been reported there, a record this early in the season.
What we're seeing right now is the huge number of viral infections and a huge amount of patients coming to emergency rooms and also being admitted to the hospital.
The situation has been made worse by a staffing crunch.
It's beyond critical. I've said before we're at the bottom of the barrel, but we're not. We're beyond that. We're below the bottom of the barrel. We scraped the barrel and we've broken through.
The premiers say they're on it, but need help from Ottawa.
We need to make sure we sit down with the federal government and put together a sustainable deal that we see continuous funding moving forward for decades to come.
Now they're getting support from the federal NDP. Jagmeet Singh is calling on the Prime Minister to urgently spend more money, cash to hire doctors and nurses, and keep the ones we already have.
Justin Trudeau has a responsibility to sit down with premiers and find a solution. First and foremost, that is the number one thing we're calling for.
Singh said if Trudeau doesn't come through, he's prepared to walk away from the deal to keep Liberals in power until 2025. The minority government needs NDP support. While politicians squabble, parents are left waiting.
I'm worried about, okay, if he does get sick, is he going to be able to have a bed if he needs to get admitted? Because there's a lack of beds right now. Is there going to be enough nurses that are on staff that can take care of him?
Okay, JP, so what is the federal government's position now on helping parents like Kennedy?
Yeah, Adrienne, the feds say they understand the situation is dire, but they're not going to cut any more checks until the provinces agree to certain terms. They want to make sure their money is going to some critical areas like primary care and mental health. The Prime Minister has said he's prepared to increase the Canada Health transfer, but what's left to be determined is how big it will be and if there are any strings attached.
All right, JP Tasker in Ottawa. Thanks, JP.